Good afternoon, everyone, and thank you for joining us here at Tweet Your Brain with Care, a presentation about best practices for men's mental health campaigns on social media. This webinar is presented by Healthy Men Michigan, and we're excited for you to join us today and hear about our best practices and social media strategies. By way of housekeeping, I want to just address a few points. The first one being questions. You have the ability to type any questions that you may have into the chat feature of our webinar. To keep the webinar on topic and on task, we are going to compile all of those questions after the webinar, and within a week, we will combine the answers from the whole team and send everyone a follow-up email answering any questions you may have. So I just wanted to address that you should expect that after the webinar and not during. We also have surveys that will be for follow-up. Surveys are really, really important to this project and our team. We want to hear from you about how this helped, maybe anything that you'd like to see in the future. So you'll be automatically directed to that follow-up survey after the webinar ends, and you'll also receive it in a follow-up email. So please take a few minutes and take a look at that and answer any questions and provide us with some feedback. You'll also see on the side that we have some handouts. So you can download the slide deck for this webinar and also a one-page flyer about getting involved with Healthy Men Michigan. Just make sure that you download those before the broadcast ends, as you won't be able to download them after, but make sure that you download those before the presentation ends. Finally, I just want to touch on the fact that this webinar will contain several action items and food for thought. So if there's any way that you want to get involved or any follow-up conversations that you'd like to have, at the end of this presentation, you'll find contact information for the Healthy Men Michigan campaign and research study. So if you'd like to follow up on any of these items, that contact information will be there. Great. So next, I'm just going to introduce our panelists. We have 4 different people speaking on the presentation today. We have Dr. Sally Spencer-Thomas, clinical psychologist, mental health advocate, faculty member, patient, and survivor. We also have Paige Beaufort, project coordinator from Cactus, a marketing agency that is the thought leadership behind Man Therapy, and also a contractor on the Healthy Men Michigan campaign. We have myself, my name is Courtney, and I am the Contracts and Partnership Manager at Screening for Mental Health, and I'm also the Program Manager for Healthy Men Michigan. We also have Dr. Jodi Frey, who's an Associate Professor at the University of Maryland, Baltimore School of Social Work, and she is also the Principal Investigator of the Healthy Men Michigan Research Study. So finally, before handing it off to Jodi to explain more about Healthy Men Michigan, just a brief overview of our agenda points. Again, we're going to start out with Jodi talking about Healthy Men Michigan and what we are looking at and what we've been doing. We are then going to transition into talking about different messaging strategies and specifically the National Suicide Prevention Week approach. We'll be talking about some best practices for social media campaigns and then tying that specifically into the Healthy Men Michigan campaign with specific outreach strategies and action items that you can follow up on. So now to give more of a background on the project itself, I'm going to hand it over to Dr. Jodi Frey to provide more of the background information on that.
Thank you, Courtney, and welcome everybody to this webinar. I'm excited to have everyone here and talking about different ways we can get more involved with social media and with our health and mental health messaging. So before we get into our specifics on the panel, I wanted to provide just a brief overview on the Healthy Men Michigan project, where we are working in Michigan to reduce suicide rates among working-aged men ages 25 to 64. In the U.S., suicide is the 7th leading cause of death for men, and rates for both males and females for all ages 10 to 84, have been increasing steadily from 1999 through 2014 and beyond. When looking at men and death by suicide, they're actually 3.5 times more often to die than women. Yet the majority of our suicide prevention services and programs have been focused on youth and older adults. It's very rare that we see programs, and particularly research studies like the one in Healthy Men Michigan, to focus on working age adults. and certainly not focused on men. So the slide that you see here is a great report, if you haven't had a chance to look at it, from the Suicide Prevention Resource Center in 2016, where they talk about some different ways that we can get involved to prevent suicide, looking at it from a public health crisis perspective. And two things I just want to briefly point out to set stage for today is that one of the quotes in this report says, "Without targeted interventions to engage men in assessment and mental health treatment, suicide will continue to increase among men in their middle years. Furthermore, suicide will continue to compromise a significant proportion of the U.S. population over the next 25 years. So reducing the overall suicide rate in the U.S. requires making a substantial reduction in the suicide rate among men ages 35 to 64 years. And that's actually something that we're doing in this project, Healthy Men Michigan. Next slide, please. So Healthy Men Michigan, as you can see, and many of you might already be familiar with healthymenmichigan.org, is a CDC-funded research study that's doing a statewide campaign throughout Michigan to encourage men ages 25 to 64 to go online for a free screening for mental health with a male-focused intervention directly and specifically designed to reduce suicide ideation and behaviors among middle-aged men. So we've been merging best practices from the two organizations up here, Screening for Mental Health and Man Therapy, to look at some new innovative ways we can do screening and referral services to increase men's help-seeking behaviors, as well as to reduce symptoms of depression, suicide ideation, and behaviors. So we're viewing this as a public health initiative, which is a little bit different than how suicide and some of the interventions for suicide have been viewed in the past. By viewing suicide as a form of violence, it lets us take a more comprehensive public health approach in trying to reduce suicide by giving us the idea that we need multiple solutions to a multifaceted problem. And so we're connecting with the community throughout the state of Michigan, both on the ground and, as we're going to hear about today, online, in order to reach out men anywhere they might be, whenever they're ready to seek help. HealthyMenMichigan.org is available to them to connect them with resources. So that's just a brief overview of the Healthy Men Michigan project that you'll hear more about later as Courtney brings us home with how to get involved. But I'd like to turn the program over to Dr. Sally Spencer-Thomas to get us thinking about National Suicide Prevention Week and other ways that we can be involved in our online messaging. Thank you.
Particular. Hi, thanks, Jodi. It's an honor to be part of this project, and I'm extremely excited to be on this webinar today as it brings two things that are near and dear to my heart together, promoting men's mental health and social media. So it's great to be here. And for those of you who are listening to this who might be new to this project, you might be wondering why 4 women are talking about men's mental health. So I just want to comment on that briefly. Yes, it's true. We are women, but we're also sisters and daughters and friends and coworkers to many men. And so we care about this issue just like the men do. And we're informed by many men in this process. It just so happens that our panel today is women. All right, so let me share a story with you about the National Suicide Prevention Week approach. This was a huge success that we had on a national level this past year for putting a National Suicide Prevention Week together. And the thought process was this: there were lots of different national and local organizations that were running their own social media campaigns and communication strategies around National Suicide Prevention Week, and they all had slightly different messages, and we all felt that our effectiveness was watered down by all of these individual, local, regional, and national efforts. And what if we were able to combine them to one unified message? How much more powerful might we be? So here's the examples of a couple of the major national campaigns that we brought together. Be the One To was a campaign that came out of the National Suicide Prevention Lifeline. It offered a number of strategies. So you could be the one to show up, you could be the one to care, you could be the one to follow up, all of these kinds of different action steps that could be promoted during the week. Takes 5 to Save Lives was the World Suicide Prevention Day campaign, talking about 5 different steps, again, that people could take. Be There actually came out of the veterans efforts for the Suicide Prevention Week, talking about showing up and being there for someone else.
And then the World Suicide Prevention Day theme was actually Take a Minute, Save a Life. So when we look at these, at least these 4 major national and international campaigns, there was a common message, and that was be there. That everybody was talking about showing up and being there for the person who is suicidal. Now, this is a limiting message in some ways because it wasn't actually targeting the people living with the suicidal thoughts unless they were called to action to be there for their future selves. It was really more of a call to action to the public to be there for one another. But this is the message that we decided to go with, and as a first pass effort, it was hugely successful. There were 3 things that we were thinking about in pulling this unified message together. Number 1, was there a commonality between the existence in the campaigns? And we just discussed that there was. Number 2, could we saturate this particular message throughout all the different ways that we get messages out to the public? Would this be succinct enough? Would it be powerful enough? And we agreed that it was also true. And then finally, was this message adaptable enough? Could different groups that were serving, say, military audiences or LGBT teens or indigenous communities or school communities, could they all adapt this message to their particular audiences? And again, we said yes. So that was a huge success for us to find a unified message that would cross-cut all of these different groups throughout the nation. The second step was really about partnership engagement. So it's one thing to have a message. It's another thing to have partners on board that we're going to be able to disseminate this message and have buy-in. So months before National Suicide Prevention Week, the leaders at the National Action Alliance started to bring together various partners to orient everybody, get buy-in, and get organized for doing this message dissemination during National Suicide Prevention Week. And I would say, I might be wrong, but we probably had 5 or 6 calls starting sometime in the spring. And each call, we would have more and more partners on board. So we'd had a bunch of partners that you would expect. This is the old guard. For those of you who are in the work of mental health promotion and suicide prevention, you probably recognize a number of these logos. We have the American Association for Suicidology, SAMHSA, the CDC, NAMI, the Lifeline, JED Foundation, and so forth. All of these folks have suicide prevention and mental health promotion as high priorities in their mission. And when they came to the table, they were already bought in and they were excited to be a part of it. And so it's just a matter of orienting them what to do and getting some additional ideas. We also needed to bring in new and needed partners. Okay, I call these the unusual suspects, people that may not have as top of their mission the suicide prevention and mental health promotion, but they are reaching new audiences. So for example, the Entertainment Industry Council, well, they do actually have mental health promotion as a high part of their priorities. However, they also have reach into the entertainment industry and many major partners there. Facebook has incredible reach, as we know. They were part of this collaboration as well. Construction Financial Management Association, not a usual suspect for suicide prevention, unless you know that construction and extraction have the second highest rates of all industries for suicide. So they came into the fold. Elhart Automotive, so a local business, for example, and even JetBlue. This gets me really excited when we get out of our little bubble of us talking to one another, the same groups that are already bought in, and when we start to reach out to new groups that can spread our message even farther. And while I think we had great success in this area, we can do better. And I think this time around in this next year, we'll have even more. So as you're putting your pieces together and figuring out your approach to whatever kind of campaign, whatever message you're trying to put forward, it's important to have a unified message that everyone is saying over and over again, and that you are engaging both the partners that are already aligned with you as well as new and needed partners. Let me transition now to what makes up a good message. And a good message in suicide prevention is not easy. We have to think about things like safety and effectiveness. So I'm going to start with safety. These recommendations have been publicized internationally and nationally based on a lot of research that shows that when we communicate in unsafe ways, and I'll illuminate what that is in a second, when we do that in a public way, we actually increase the risk of what we call contagion. of copycat behaviors around suicide. So you may have heard of this, like if there's one suicide in the school, there may be 2 or 3 within that school or neighboring schools that people over-identify when the communication around a specific suicide has been unsafe. They can over-identify with the victim, and that can increase an individual's risk. So these are some of the things that the research has showed us that we don't want to do. So we don't want to go into any kind of detail about suicide methods, location, the death scene, any kind of gratuitous detail like that that really isn't necessary in a public communication. We also want to avoid negative narratives that use language that suggests that suicide is inevitable, that you can't see it coming ever, that it's unsolvable, or this is a tricky one, that's an epidemic. One of the challenges that we have in being communicated about suicide prevention is that we want to create a sense of urgency. This is a priority, and it needs to be top of mind for our leaders and our systems within a community. So many of us have tried to increase that sense of urgency by really emphasizing the death data or using words like epidemic. And this is something to be cautioned about, because when we do that without all the other pieces of safe and effective messaging in place, we run the risk of creating a self-fulfilling prophecy. We could run the risk of creating a negative narrative or a script that then becomes the expectation. So for example, when the Veterans campaign came out a couple of summers ago, 22 push-ups a day for 22 days, we were all very concerned because that 22 represented what at the time we thought was the number of veterans dying each day of suicide. So every time a video was posted of people doing 22 push-ups for 22 days, all we were reinforcing was the death data. So some of us tried to interject and change the narrative by having people not do 22 push-ups for 22 days, but to do 30 push-ups for 30 days to emphasize a positive narrative of people, that's the number of veterans and military who reach out every day to the Lifeline and are actively rescued. So you can see the difference, death data versus help-seeking and rescue data. Another don't is not to reinforce negative stereotypes, myths, or stigma regarding suicide prevention. That seems fairly obvious, but sometimes we don't know what we don't know. We don't know the stereotypes, and sometimes we inadvertently reinforce them. We don't want to romanticize or glamorize suicide by saying things that, like, he's at peace now, or he went out with a bag of glory, or anything like that. And another piece that's really hard for humans to do is that we don't want to blame the suicide on a single cause. What the human tendency is in times of chaos and in times of tragedy is to simplify a situation into one talking point, and also to distance that as far as possible from ourselves. So, you know, it's only the kids wearing trench coats kind of narrative. That's a natural human tendency to do that. So we have to fight that, and we have to fight this single cause narrative by acknowledging that suicide is a very complicated behavior, a complicated set of situational things coming together in a point in time. And that's something that reiterates that it does take a public health approach to solve. On the flip side, we do want to do a bunch of other things. We do want to offer helpful resources and really reinforce that under all kinds of circumstances, whether you're dealing with a suicide crisis or you yourself are having suicidal thoughts or someone you care about, is help seeking is reasonable. It's understandable that you'd want to reach out and get support during that kind of experience. We want to make sure that we're constantly reinforcing that everyone can do something. It's not just the experts that can intervene and make a difference here. Everyone can do something to prevent suicide. And in the next couple slides, I'm going to share a little bit about what creating a positive narrative looks like, but this is possible and we can do this. Let me just make this last point. Don't be afraid. I know I outlined a number of things here about safety, but no messaging is actually worse than, in some instances, relatively unmessaging. If we're zero silent about it, it will never get changed. So follow these guidelines and you're going to be great. Please do talk about suicide and healthy and safety, and about health and safety priorities. Next slide. Okay, so what does shaping a positive narrative look like? This might be a little paradoxical for those of you who are thinking about how unimaginably tragic suicide is. How could you possibly create something positive out of it. There are a lot of positive things that we can talk about. There are stories of hope and recovery. We can give positive actions that people can take and really create a narrative around these things like hope, connection, healing, resilience, recovery, help, support. At the heart of all of these things, I have found, is the secret sauce of what we call lived expertise. So lived experience are people who have lived through suicidal thoughts, suicide attempts, or suicide grief. Lived expertise means they've really thought about those experiences and they've really integrated them into the narrative of their life and really reflected upon what was healing and hopeful and how they got through it. When I hear stories of people with lived expertise, whether that's living through the despair or the grief, you cannot help but get connected to their resilience and get connected to their roadmap for recovery. It is the secret sauce in all of our messaging. It becomes human at that point, and it moves hearts far more than any facts or graphs or charts or theories ever could. So it's not the only way to create a positive narrative, but it is the most powerful because it really brings us into a point of connection, that we're all human and we all struggle and we can all get through it when we pull together and when we use our resources. Other pieces of positive messaging that are really important are to really reinforce that help is available, prevention is possible, and there are many effective programs and services that people can tap into. All right, so let's make a little bit more note about how to make messaging effective. We talked about safety, using safe messaging and creating a positive narrative. Now let's talk about what makes messaging effective. The very first thing to note is that if you want to reach a certain population, you must know this population. You must pay attention to this population and you must listen to this population. You must be able to understand, number one, how they get their messages. Number two, what kind of language they need to hear, what makes sense to them, what's a turnoff to them. And the only way you get to get this information is by submerging yourself within those communities. So for example, the Man Therapy campaign that Paige is going to be talking about a little bit more in depth in just a second, we spent incredible time on the front end of that with focus groups and in-depth interviews and surveys. We tested out messages and we continue to test out messages every time we have a new sub-campaign because what we, the creators, think is great may be very different than what the end user might think is great. But what we learned from this process is that we have to use manly language that resonated with our different audiences. And sometimes the quote unquote manly language that resonated with a more general population no longer resonated when we got to subpopulations. So for example, the general population loves our character, Dr. Rich Mahogany. They think he's funny, they think he's effective. But when we tested out Dr. Rich Mahogany, the character, with our subpopulation of veterans and military, he wasn't manly enough. He wasn't in shape. It looked like he didn't serve. So he didn't resonate with that subpopulation. And so for that sub-campaign, we pulled him to the background. So you can't fix your mental health with duct tape is probably our most popular message that we have out of the Man Therapy campaign. Here's a couple of additional ones that we've developed for Healthy Men Michigan. Hammer, check. Hard hat, check. HealthyMenMichigan.org, check and mate. Know all the tools in your arsenal with HealthyMenMichigan.org. So this can go a number of ways. It can go towards our military veterans. It can go to our construction audiences. A number of people can resonate with that message. Number two, are you trying to outrun your feelings by throwing yourself into activities such as fitness or work? Those could be signs of mental fitness concerns. Take a quick anonymous online mental health screening at HealthyMenMichigan.org. So what you're hearing there is not just the mental health language that resonates, the manly language, but it's value congruent. It's about fixing problems. It's about strength. It's about mental fitness, preventive maintenance. It's using tools. All of these things are value congruent with our audiences. They're also really positioning this as self-care, about resilience. You're not hearing a whole lot of despair in here. And all of these position this in this positive, safe, and effective way we were talking earlier. And then finally, for this slide, another thing that's really important in effective messaging for this particular audience of men in the middle years is the partners who help you deliver the message. One of our successful webinars that we had through Healthy Men Michigan, we were partnering with a former NFL quarterback, Eric Hipple. And that kind of credibility from a messenger can be very helpful. All right, so sometimes I get feedback from folks that are new to this, that this is overwhelming. How could we possibly do all this? We don't have the funds, we don't have the manpower and so forth. And so my message to all of you is, you know what, it's really not that hard, especially when you leverage what you already have. It is probably a better strategy than hiring somebody or one-offing just a campaign or one awareness day or whatever. If you are able to bake in these messages rather than bolt them on, bake them into the things that you already do, listen to where health and safety is already showing up, and then weave this kind of content in there, chances are that communication is going to be far more sticky and it's going to last a lot longer than if it's just a one-off campaign. So, for example, do you have monthly newsletters or other kinds of communication that's going out regularly to the people you're trying to reach? If so, can you drop some of this in there, weave it into some of your other content or talking points? Also, on Facebook and some other places, it's pretty inexpensive to promote certain posts. And when you do that, you can target very specific audiences. You can identify where you want that post to show up in certain folks' feeds. And that way you're much more likely to get a hit when you're wanting one. And Paige is going to talk a little bit more about that. There's a couple of tools that you can use that help with this. I use Hootsuite, which is awesome. There's also TweetDeck and a couple of others where, you know, for over a period of time, you can just plug in all the content that you want to have going out, maybe one tweet a day or one post a day. And then you set it and forget it. You walk away and it just miraculously happens, and it's fantastic. And then finally, another no-cost thing that you can do that really makes it fun and effective is you can look for what's trending, whether that's hashtags or various topics. You know, right now, if you want to tie something into the Olympics, that way people can stumble across your message when they were looking at other things. One of my favorite examples around this is, you know, did you know that there's a National Donut Day? I did not know this, but there is. How might you tie in your communication about men's mental health into National Donut Day? You might talk about self-care, you might talk about nutrition, but you can get really creative. It can really spark some creative ideas when you're trying to connect your talking points to what's trending. And then what gets the most engagement? We are largely visual creatures that want to have our hearts moved. So anything that puts visual content in front of your audience is going to be more effective than straight up text, especially if the visual content is humorous, compelling, and clever. And again, you have to be very careful in this area when you're talking about men's mental health and suicide prevention, but as we've had success with both Healthy Men Michigan and Man Therapy, it is possible. You do probably want to test it out before you take it out there, but this type of note, this type of experience goes so far because people will reshare it because it's humorous, compelling, and clever, and so forth. And then finally, the other piece you want to put into your posts are some kind of next step or action step for somebody to take. So a resource link, whether that's a website or a something to read or something to look at or whatever, will increase the likelihood that people pass those messages on. It all comes down to engagement. That's what you're looking for. And there's many different ways to get this. You can get it from webinars like we're doing today. Podcasts are another great way to go in depth with a particular thought leader or a story. Blogs are really great for searching. They also can stay up and around a long time. And then videos definitely is the hot thing to do right now because it hits all those notes of seeing people and feeling people's stories and so forth. And there's lots of great tools out there you can use from your phone to create really effective videos that Facebook and Twitter just love. They just eat it up, and all their little algorithms kind of push that kind of content to the top of everybody's feed. So videos are your friend, and you don't have to do them live. Live actually gets the best kind of engagement, but I can understand why that's daunting for many people. So recording a video and uploading a video can also be super helpful. And just a little tip that I've learned, keep your videos about a minute long or over a half an hour. Under a minute, really just making one point, kind of announcing something or commenting on something really quickly, gets a lot of hits and attention. And then the next marker is at about 30 minutes. So if you wanted to do a more in-depth interview, or you've had something much more in-depth to say, 30 minutes is kind of the next level that gets a lot of engagement. And then after that, you'll start to see pretty significant drop-off. All right, let me give one more example about what this looks like. And this is from the engagement mechanism called Twitter chats. I've been doing these now for probably a year and a half, and I love them. They're so much fun. So this is what it looks like. Again, it costs you nothing, and you can put it together relatively quickly. The way I like to do it is to put an esteemed panel together, and this is the one we did for National Suicide Prevention Week last fall. You can see a number of the usual suspects up there, plus we've got some thought leaders, people with lived experience and so forth, all coming together in a point in time. What made this effective is that each of the partners then reached out to their constituents and said, come to this event. They were prepared by using answers to a series of 4 questions that I gave them ahead of time. So on the night of the chat, within 1 hour window, they are posting feverishly with things that they had already prepared in answers to those questions, and they're responding to each other. It's incredibly dynamic and engaging, and we had hundreds of people show up for this Twitter chat, and everybody is retweeting things. Just for an example, we're going to hear a little bit more about Healthy Men Michigan Take 5. This is a perfect message. It shares all the things that I did mention before about safe and effective messaging. It's a visually appealing graphic. This one graphic was retweeted 19 times during the chat. So that's just one example of the level of engagement that we have. And then here are our analytics. So we can run this through a widget called Simpler, and they give us this end result of numbers that we can look at to see how we did. And let me just draw your attention to the number in the upper right-hand corner. That's 27 million impressions. The time span for this was the hour of the chat, a little bit afterwards as people continued to talk, and a couple days before as we were promoting, working our way into it. 27 million impressions is astronomical. We were trending actually during a period of time on this because it was so powerful. You could see we had 439 participants and lots of engagement by not just the national partners, but many, many people who showed up to participate in the chat. And now I'll turn it over to Paige, who's going to talk a little bit more about what Cactus has taught us about engagement.
Thanks, Sally, for handing it over to me, and thanks everyone for joining us today. One great way to really be time efficient and support mental health initiatives on an ongoing basis is to plan out your posts ahead of time with movements and events that you can predict. So creating a content calendar like the one on this slide for Healthy Men Michigan is a great way to map out those things ahead of time. And Healthy Men Michigan does a particularly great job of arming partners with great content to use over a span of time. Taking an hour or two in pre-scheduling these posts to be most time efficient is a really effective way to engage over time. However, there are also lots of times when movements are happening or national conversations are occurring that you can't quite plan out. So get in on that conversation too, and don't be afraid to jump in and interact with folks. You can watch for relevant hashtags. Twitter lets you follow certain hashtags, I believe. You can set Google alerts for keywords and understand when a lot of articles are coming out about a certain topic, and make the technology really do the work for you. It doesn't have to be time consuming, but a little does go a long way. You can also share and comment on other posts to do some community management when you can to grow your network. And interacting authentically really helps you stay on the brink of these issues and be a key player. Because social media is at once a one-on-one touch point, but also a connection to a greater movement, we really have the opportunity to break down the barriers that this audience is experiencing. And one key way is by providing value in those posts. So value can be anything identified as having true utility for the audience. For us at Man Therapy and Healthy Men Michigan, this is often the connection to an important resource, sharing of stigma-reducing information or facts, or most often a laugh. So use those lived experiences and stories that connect that Sally was speaking about, and also engage and make it kind of fun for people to follow you. This gives them a reason to continue following up with you, share your information, and keep coming back for more. And it's kind of a long-term engagement strategy for a really quick interaction that may be only 10 seconds and kind of imprints you in people's minds. Beyond your audience, keep in mind that a lot of the people reaching out and getting resources and sharing may be the loved ones of your primary audience. So keep them in mind as well and do some outreach in those groups too. As Sally mentioned, and as you can see in all of these examples, a little goes a long way in paid social advertising. So while you can use all of these tips to foster organic growth if you don't have a budget, putting even a little bit of dollar amounts behind these initiatives during key moments can really help you target people and, again, become a main player. Social targeting is super powerful, especially when you're trying to reach a specific audience like we are. So adding paid promotion guarantees that you'll reach these folks in a very targeted way by demographic. And boosted or not, you can also use analytics on any social platform to better understand what's landing with your audience and what's not quite hitting their radar and adjust from there. It allows you the flexibility and kind of to play around with the time of day that you're posting, the tone, the way you're scheduling and interacting with hashtags and movements and events and trending topics. Also, as Sally mentioned, visual posts work way, way better than just text-only posts. So be active about pulling in an image, an infographic, an article, a video, any kind of multimedia. Not only does the algorithm heighten the visibility of those posts, but also people who are reading them really do enjoy them more. Think of how much time you spend scrolling through social media, and a lot of it is because of that visual interaction at drawing you in. Because text on images is limited by social media platforms, you can pair these really creatively with captions that keep your graphics fresh and allow you to make a true statement. And just like any other advertising, it is really essential to understand your audience and your own brand to make the most of this messaging. As I mentioned, we found it's most effective to speak to this audience the way they speak to each other. So engaging them with humor, addressing stigma head on, and providing real tools and value. For example, with this audience, what do you think lands better? Describing mental health in academic terms or using a sports analogy like we have here? Of course, the analogies are more attention gripping for this audience. So be creative with it and really have fun with it. And keep in mind that mental health manifests in many forms. So taking a holistic approach and looking for information about anger, anxiety, and this depression is really important to meeting people where they're at. Humor and resources and all of these pieces are all part of providing that true value and getting people to come back over and over again. And that is how we've been able to collaborate with Healthy Men Michigan and partner to leverage both of our strengths and all of our learnings to create effective messaging. So now I will hand it over to Courtney to speak about how these best practices have informed Healthy Men Michigan outreach.
Thanks, Paige. I appreciate your input and Sally's input. So I want to kind of take everything that we've talked about today, and I want to kind of wrap it back up into framing it around Healthy Men Michigan and kind of talking about how we've taken these learnings from, lived expertise and from our partners like Cactus, and talk about how we're using that with Healthy Men Michigan. So on your screen right now is our homepage for healthymenmichigan.org. So we obviously want the focus of that to be the take a screening, which is the main part that you see there, so that anyone who's reaching out for support kind of sees automatically where they should be going for those resources in that screening. But the website also serves as kind of a holding place and a hub for all of our promotional materials, our social media posts. And so I will go through what our downloadable resource center looks like on the next slide, but I just wanted to point out that that's another major part of our website, is making sure that providers and caretakers and anyone who has a man in their life that can kind of fit this criteria has some promotional resources to make it easy to promote. Again, kind of touching back on Paige and Sally's points about leveraging what you have and not reinventing the wheel. So using a lot of our promotional materials to generalize it to any audience that might want to utilize it. So on your screen right now is what it looks like when you click that downloadable resource center link. So this is the front page of our downloadable resource center. There is a lot of different materials in there, as you can see. It starts with a brief survey asking how you currently are promoting Healthy Men Michigan. So this is a really interactive place for promotional partners to tell us what's working for them, what might not be working. And then going down, you can see all of the different types of social media and strategic outreach materials that we have. So under our social media tab, we have a lot of our infographics and our posts. That way, all you have to do is download the image and you can post that right onto Twitter, right onto Facebook. And again, like Sally and Paige were saying, with TweetDeck or Hootsuite, any of those content management software, you can download, multiple ones like that and schedule it to be posted so that you're not constantly trying to, manage different types of campaigns that you'd like to promote. You can get all of that set up about a month in advance. So we have all of those laid out there. We also have the slide decks for our webinars. So all of that information we will make sure is readily available to all of our partners. So those include the webinar that Sally had mentioned previously with Eric Hippel, that's available there, and all of our other webinars, as well as a link to our YouTube channel. So we have all of our previous webinars posted there where you can listen, comment, and provide feedback. So we want to make sure that all of the information that we've already put out there, that we've already done, is easily accessible to anyone who may not have seen it. And then wrapping up in the downloadable resource center is where we keep our monthly promotional newsletters. So same idea as our webinars. We want newer partners to be able to go back and see all of the work that we've done previously, all of the promotional efforts we've done, and get a feel for exactly what we're trying to accomplish with it. That way it's as easy as possible for our partners to continue to promote this campaign. Sally briefly touched on our Take 5 campaign, which we actually launched this at our 1-year anniversary of Healthy Men Michigan as a way to kind of re-engage folks and talk about some of the great work we had been doing, all of the great partnerships we had been making, and try to further that. So we had already had a lot of conversations with groups in Michigan, and we wanted to basically help those organizations leverage the promotion they were already doing into one kind of easy, tangible, step-by-step method. So we have here pre-written emails. So those can be found in our downloadable resource center, as well as our pre-written social media posts. We have wallet cards and flyers in our shop, which I will show you the link for that in a little bit. But as you can see here, all of these are very tangible action items when we're talking about mental health campaign promotion and getting the message out there. And like Sally said, saturating the public with one specific message that everyone can kind of get behind. Something like a Take 5 where there's an easy graphic and some very concrete action items is a great way to get people re-involved. So I also just want to touch on, we're talking a lot about social media and a lot about our online promotional efforts, but there's still something to be said about kind of old-fashioned, in-person, boots on the ground work. And so that's what our social media is really meant to supplement. So with a great social media presence online, it makes your in-person community outreach a lot easier. It puts faces to names, and it helps kind of make those events go a little bit smoother. So we have here several different images of promotional partners. We have the Marquette County Health Department. We have the Saginaw Survivors of Suicide, Kirsten's ride and Kevin's song on here. So, talking about social media campaigns and really leveraging what you're trying to accomplish online and on social media doesn't negate from the importance of still having those face-to-face, in-person, physical interactions and conversations. So this is just some of the ways people have kind of taken our printed in-person materials and done outreach for men in Michigan in person. So right here on the screen, you will see 4 different links. You will see the link to our Facebook page, the link to our Twitter page, our website, as well as an email, which you can contact if you have any questions regarding promoting the campaign whatsoever. That email goes directly to myself, so we can, brainstorm if there's specific questions you had, if there's some type of promotional item that you're specifically looking for that you don't see, or any conversations you want to have about getting the word out about mental health, specifically men's mental health in Michigan. These are all of the ways that you can contact us. And then what I was touching on before, we also do have an online shop where you can choose any type of, we have flyers and wallet cards currently, and we are also in the process of updating that with some of our new social media learnings, but you can access the shop and we can send you any type of person promotional items that you may need. So looking at that slide previously, all of those items were ordered through our online shop. They're free of charge, and we can send those to you for whatever type of in-person community awareness event that you may have. Again, the first link is our downloadable resource center that I showed you a little while ago. That is a really comprehensive place where all of the things that we touched on and all of our promotional support items are held. So I definitely encourage you to take a look at that in our shop. We also have our website here. Our webinars are listed there as well, of course, our screening. And then again, you can reach out to our email and ask any additional questions that if you didn't want to enter into the chat, any specific promotional questions that you have for Healthy Men Michigan. And then just some further contact information. Again, my name is Courtney Miner, and I handle the campaign promotion and a lot of this aspect. And any questions about the research portion of Healthy Men Michigan can be directed to Dr. Jodi Jacobson Frey. Her phone number, her email is right on the screen here. So if you have questions about the research aspect of all of this, definitely feel free to contact her. And any questions about promotion or our campaign or anything like that, my contact information is right here, and I'm more than happy to either email or set up a call, whatever works best for you. And so to end, I just want to say thank you to everyone for joining. We really appreciate your efforts in supporting Healthy Men Michigan, promoting on Twitter, on Facebook. We've been trying to be really active with those. So if you see anything, definitely retweet us and interact with us on there. We're definitely trying to increase that presence, and we look forward to connecting with more of you guys outside. So thank you for joining us, and we'll talk soon.